Hey folks, how's it going? This is another coronavirus COVID-19 SARS-CoV-2 pandemic, whatever you want to call it, employee benefits video. This is on group health plan coverage. Going to cover a range of issues, testing, vaccines, HSAs, etc. So just remember this is time sensitive. It's as of yesterday from when I'm recording it, April 6th, and it's time sensitive. It could change and it likely will change. Disclaimer, I'm not selling anything. It's not legal advice. All of this could change, and these are just my opinions. They're no one else's opinions. So I hope you find it helpful. Quick roadmap, going to go through testing and health coverage of that, and then coverage of vaccines and other treatments, then some HSA and high deductible health plan issues, and some other assorted issues related to health coverage and COVID-19. So health coverage of testing for COVID-19 and coronavirus. Under the Phase 2 law, the Families First Coronavirus Crisis Response Act, and under Phase 3 as well, we've got a lot of mandates here, but essentially health plans have to cover SARS-CoV-2 testing at no cost to the participants. So that's no deductible, no copay, no coinsurance, nothing like that. They have to cover it, they have to pay for it. They also can't have any medical management, pre-certification, no prior authorization. So care management is just when they're trying to review and evaluate and coordinate your care. They're not allowed to do that. Normally, they're doing that to both improve care and to reduce costs at the same time. But care management, medical management, that's not allowed, and they can't do prior authorization. They can't require you to call and deny the test if you don't call. They also have to cover an office visit that's related to SARS-CoV-2 testing. So that includes in person at your doctor's office, that includes telehealth, telemedicine, urgent care, emergency room, and all of the items and services during the visit to the extent they're related to coronavirus testing. That's all covered without cost. They even have to provide no cost coverage for testing that's out of network, which is relatively unusual. The CARES Act specifies how this pricing will work if it's out of network. So if there's a negotiated rate, then that would apply. But otherwise, out of network usually means not a negotiated rate. And that means that the out of network provider will get a cash price. But the cash price has to be online. So each provider has to put it on the internet somewhere publicly available to anyone. So you can actually look that up yourself, even though if you have any health coverage that's covered by these rules, you wouldn't be paying. You can see what the price is. So that clears up some problems from the Phase 2 law, the FFCRA, which just said it had to cover out a network, but it wasn't clear what that meant. Now we know that there has to be a price, and the hospital or doctor's office or whoever has to put that price online. It's going to apply to almost all U.S. health coverage employer, whether you're self-funded ERISA plan or you're a fully insured plan, individual, small group, Medicare and Medicaid, all sorts of different health coverage. Generally speaking, it's going to apply. So what about treatment? Well, treatment is a little different. Health coverage of treatment is not part of the testing rule. So there's no cost treatment. There's nothing like that. It's just treated as any other regular expense. Now, if there's a vaccine, that would be no cost preventive care under the Affordable Care Act. And under the Affordable Care Act, Obamacare, that would have to be covered by employer plans and other group health plans and health coverage generally. Uh, the vaccine has to be recommended by the CDC or the U.S. Preventive Services Task Force. That's the process under Obamacare. Now, the difference with the CARES Act is that the coverage of the vaccine is accelerated. So normally under Obamacare, it's the following year after the recommendation is when a health coverage option of a health plan would have to cover that vaccine, but the CARES Act reduces it to 15 business days or less. So that is rapid coverage, which is probably appropriate, at least given the general urgency of the pandemic. So I think probably a lot of plans were intending to cover it, but they did need a law change in order to accomplish that. So what about HSAs, health savings accounts, and high deductible health plans? So what are the changes with COVID-19? So, well, the first one came out March 11th from the IRS, and they released a notice. It was before Congress got Phase 2 or Phase 3 off the ground. And it just said that if you've got a high deductible health plan, which is necessary for HSA eligibility for tax purposes, that The plan can cover testing before the deductible, treatment before the deductible, to the extent they relate to COVID-19, coronavirus, SARS-CoV-2. Uh, there's no cost sharing requirements. Normally, a high deductible health plan would not be allowed to do that, but in light of the emergency, the IRS acted quickly, so you can preserve your HSA eligibility even if your high deductible health plan waives the deductible for those things. So pretty useful if you're in an HSA and you want to contribute. The CARES Act also had to follow up on telemedicine or telehealth to specify that a high deductible health plan may cover telehealth or other types of remote medical care without cost sharing. Previously, the phase two bill, FFCRA, had required telehealth coverage, but it wasn't really clear on high deductible health plans what that would mean and how the administrative legwork would shake out. And the CARES Act came through and just said, rather than figuring out if some testing is present in telehealth or not, and figuring out which type of telehealth you're dealing with, because remember, the testing has to be covered without cost sharing, even if you're a high deductible health plan. Instead, for now, up through the plan year 2021 or earlier, telehealth can be covered without any cost sharing, just to simplify it so you don't have to figure out in advance if it's related to coronavirus testing or not. And that, again, preserves your tax eligibility to contribute to an HSA. There's also a change for over-the-counter drugs. The CARES Act has eliminated an Obamacare ban on pre-tax reimbursement of over-the-counter drugs. So the ACA had gotten rid of that, primarily for revenue-raising reasons, but also just to reduce expenditures on healthcare generally. It's been relatively popular in various quarters to add it back, and so now they have added it back, probably because they expect a lot of people are going to need supplies and that they won't be able to get to a doctor or hospital for a prescription. So they might have to rely on over-the-counter more than usual. And it also adds an interesting twist. It adds menstrual care products to the list of products that could be paid for out of an HSA. So that is quite useful. Especially both of those could be quite useful, especially if you need to reimburse yourself on any major stocking up or even hoarding purchases that you made in March or even earlier. Anything back to Jan 1, 2020, in the realm of over-the-counter drugs or menstrual care products, any of those, you could reimburse yourself out of your HSA, or from now going forward, you can use your HSA to make those purchases. And the OTC change is also going to apply to health FSAs, health reimbursement arrangements, and if you've got one, an Archer MSA. So we've also got some other various issues about group health plans and health coverage and COVID-19. Just in general, ERISA deadlines could be delayed by the DOL. It doesn't look like they've done it quite yet, but for the public health emergency, they are allowed to delay those reporting deadlines. So if you're an employer plan, you might look at that. That might be helpful. The CARES Act also instructs Health and Human Services to issue guidance on HIPAA and the sharing of public protected health information during the pandemic. So we'll see what that looks like and if it changes any obligations or duties. They also changed the rules on the disclosure of substance abuse records, and mostly they're making it align more closely with HIPAA, which protects individual private health information. It's largely unrelated to the pandemic, to COVID-19, but it was in the CARES Act. Employer plans, for the most part, are not going to be affected much, probably, but insurers and third-party administrators and employee assistance plans and wellness plans might all be affected. And then some other issues, there are a lot of Medicare changes, so if that affects you as either a vendor or a participant or a provider, then that's something to look into. They also expanded, so they expanded telehealth. They stopped the sequester for Medicare for 2020, but extended it from 2029 to 2030. Some expansion for vaccine coverage in Part B, 3 months supply for prescription refills in Part D, etc. So that's something that might apply to some. The cash price online, I already mentioned it, but this is an interesting one, so I wanted to really draw it out. It only applies to the SARS-CoV-2 testing, so coronavirus testing. And health providers can actually be fined by HHS if they offer a corona test, but they don't put their price online. And this really has large impacts for health pricing, and I don't want it to get completely swallowed up by the moment because this is really important. There's just really dysfunctional pricing in the health market at every level. No one is tied to a price. Everyone dislikes how crazy prices have gotten. Insurers and employers and hospitals and doctors, everyone is bidding up prices because or bidding down prices because there it the pricing mechanism just has broken down. And it is really interesting to see some kind of an effort to at least make public prices, even if it's not paid by the participant, by the actual person who wants it. At least we know what it is, which is how dysfunctional health pricing is in the United States. That not only is it disconnected from actual supply and demand to a significant extent, but it's often private. Every insurer might have uh, a different price from the same hospital for the same procedure at the same time from the same doctor and the same surgical team, right? It could be wildly different prices. So this is a really interesting issue. I've really gotten into it. I've actually got a book here by Marty Makary, The Price We Pay. He is a doctor and he really talks about this kind of stuff. And his big thing has been trying to get transparent pricing. So I'm going to use this opportunity to say this is a really interesting book, and if this is an issue that you're interested in, I really recommend it. I've really enjoyed the book. I'm about half to two-thirds through, and it's been very interesting. A lot of sad, depressing anecdotes he packs in there, but there's clearly a lot of research, and it raises some important issues. Um, and I really wanted to call it out because I think it's interesting how it's just this tiny little corner of the coronavirus pandemic, but it's actually very important to the larger healthcare debate and the market. So those are the big issues I wanted to hit, but let's talk about the takeaways again, just in case you missed it. So testing is going to be no cost to the participant if you've got coverage. The vaccine, if they get one, is going to be rapidly covered. Uh, there are some high deductible health plan exceptions for COVID-19, both testing and treatment, if your plan chooses to cover it, and also for telehealth, again, if your plan chooses to go that way. If you've got a health savings account, it now covers over-the-counter drugs and menstrual products. And once again, all this stuff could change. We're spur of the moment here, so more changes to come. You should expect it. And some of this stuff has a sunset, so it's going to go away. So just all of this has an asterisk. It's all kind of temporary, and it could go any direction. So just bear that in mind. And again, so we are in the middle of a crisis. So what can you do? Stay home if you can, and wash your hands. More than you think you need to, and wear a mask, a cloth mask. Don't take a mask, a high grade mask away from medical providers. But if you've got a mask, or if you can make a cloth mask at home, go ahead and wear it. You're going to look silly, but it really helps you to lower the risk for everyone else and lower the risk for yourself. So don't be embarrassed, and go ahead and try and stay healthy. So I hope that some of this stuff has been helpful to you, and take it easy, stay well.